I want to thank everybody who made the time to join us today. I know in the world of Zoom meetings that you can say yes to at noon on a Thursday, we're probably not your only choice available, but I thank you very much for letting us be your first choice today. So the intent of today's webinar was to put together a group of panelists who can answer great questions that we believe people in property management are asking right now. Obviously, COVID-19 is something that has kind of taken our world and turned it upside down and shook it like a proverbial snow globe, and we're watching all the snow settle around us and wondering what we need to do next. So our first, oh wait, I got a few other notes. Okay, just some general housekeeping stuff. At the bottom of your screen, there is a Q&A button. If you click that, you'll have the opportunity to ask questions. So what we're going to do is just ask everybody to put their questions in the Q&A section. And then after everybody's presented, we'll go ahead and run through those questions for everybody. So then that way you don't have to remember, you can just put them in there and we'll know that they're there. Everybody who is attending today's event will be entered into a giveaway. And we'll go ahead and notify you after the event, but we wanted to make sure that the giveaways were going towards local businesses and local enterprises, things such as Hawaiian Airlines, things that are near and dear to our community. And yeah, okay. So our first presenter today is Sue Savio. Most of you probably know Sue. I think when I first moved here over a decade ago, I met Sue very quickly. She's the president and owner of Insurance Associates, Inc., and she manages countless policies for condo associations through the state of Hawaii and also serves on 3 boards herself. Go ahead, Sue, take it away.
Thank you very much. I have 3 boards because I have nothing else to do. Anyway, we're going to talk about COVID-19 and insurance and whether you have it or you don't have it. Next slide, please. So the first thing that people question is, do you want to move the slide, please? First thing that people question is, do I have business interruption? My property coverage. Do I have business interruption? Do I have loss of rental income if I own a condo, or loss of use? And do I have expense to disinfect in case I do get a COVID case in my business or in my office or in my restaurant? And we're going to talk about property coverage first. And what happens is, for there to be coverage for business interruption, there has to be damage to the premise by an insured peril. So if you have a fire, or your pipe breaks and damages your unit, or lightning strikes, or smoke damage from the next door neighbor, whatever the case may be, as long as it's an insured peril, you have business interruption. So for all the businesses, and I don't care whether you are a hotel that's lost tourists, a restaurant that had to close, a printing shop that can't have any customers anymore, beauty parlor, whatever, you were closing because of COVID-19 and the government put out an order. It was not something that we can insure under your property policy. We have to have damage to the building or the structure or the business you operate out of. And there was no property damage by an insured peril. So unfortunately, everybody who wanted to file a property claim hoping they had business interruption, it does not fly. Loss of rental income, the same situation. Many people have short-term rentals. Many of us have long-term rentals with tenants who've been there for 10, 15 years, for those of us who have long-term rentals. And unfortunately, they have no income. They've lost their jobs or they're not working, and we have loss of rents. It's not something that insurance is going to cover. Again, for loss of rents, you have to have reason that your premise is not rentable to be an insured reason. Fire, lightning, windstorm, smoke damage, vehicle damage, hail, smoke, water overflow, those types of situations. COVID-19 does not make it. The expense to disinfect, you have a tenant, or in our own office building here, it was reported one of the offices had, we're a condo office, one of the offices had somebody who had COVID-19. So we had to disinfect all the common areas and all the elevators. So because the other people who were working in the building, even though half masked because we had a social distance, there's nothing to protect or pay for that bill, okay? The association as a whole had to pay for it out of our maintenance fees. So property coverage wise, the answer is no. There is no coverage for COVID-19 or any kind of a pandemic situation. Next slide. Okay, the cost of this property loss, the American Property Casualty Insurance Association estimates that it is going to be $383 billion per month at the rate we are going. That's a chunk of change. And if the insurance companies could cover it, I don't know of any insurance company that has that altogether, has that kind of money to pay claims. But it is a very expensive illness that has affected every business. I don't care what business you are in, we're all being affected by this. Next slide. So how about liability coverage? Property doesn't cover it. What if I get sued? Somebody gets COVID and they blame me, my employee, or if not my employee, my tenant, or someone that lives in the condo because there's a COVID person in the building, okay? How about liability? The problem with the liability says at this point, we don't have anything that says pandemics aren't covered. They don't cover viruses and they don't cover pollution, but these obviously, pandemic and COVID-19 is not pollution, it's not a virus. So at this point, the carrier is saying, if you want to file a claim because someone is suing you, file the claim. We will look at the reason and their thoughts. We will see, and then we will more than likely have to provide a defense. Not guaranteed, it's going to depend upon what they're suing you for. But at this point in time, the claims will be adjusted based on the circumstances of a specific loss. So if I say an employee comes in and says, I've got COVID-19, an employee is covered by workers' comp. Workers' comp will take care of that. But if they decide that they want more, they're going to sue me, which they can, then they have to pay back workers' comp if it pays. Then that's up to them to prove that I caused them to get that COVID, okay? Or to get sick because of COVID. So at this point in time, we are filing, anybody who wants to file a claim, we're filing claims. Do we expect them to be paid? Not really, especially the property claims. The liability, if they can prove it was truly from what there's that business or that operation, then possibly there will be a specific claim that will have to be covered. But it's very much up in the air now. There's nothing that says, yes, we're going to cover your COVID claim in your liability policy. So it's, if you think someone's coming after you, file the claim. But don't do, I want to say, don't do stupid things like, oh, we don't care about social distancing. We're not going to wear masks. We're going to let anybody do what they want. Then you're going to get yourselves into trouble. But if you're following all the rules that the government is putting out, don't open your pool until they opened up the other pools. Don't open your tennis courts. Don't open your spas. If you're following what the government does, that's a defense for us to use to say that we've done what we were told to do. We took care of our people. We tried to do it right. We had signs up about social distancing. We reminded people the way to behave. Then you're doing what the government's doing, and you're just hoping that it is enough, and it should be in a court of law. Next slide. So under most general liability policies, as I said, there's no virus or communicable disease exclusion, okay? And a virus is not bacteria nor a fungi. So a virus would not fall under the pollution exclusion, but it could be technically considered a contaminant. So it's up to the judges and the jury to decide how they're going to handle it. And what happens in most cases is, even when an insurance company has an exclusion, if the courts feel that the insurance company has to pay something because they're the only ones that can afford it, they have, like asbestos, they have in the past, forced the insurance companies to cover it. So we'll see what happens in the future on this type of a situation. So let's go to the next slide. Future coverage. What's going to happen with the insurance industry? Well, there's a new form coming out, and it is a communicable disease exclusion, as you can imagine, because nobody can afford, even the insurance companies all together, to be paying $383 billion a month if it truly is that amount. So there is going to be an exclusion that's coming out. It will be starting as your policies renew, it will be added. It's going to be this form CG 21320509, and it is a communicable disease exclusion. Okay, so this way it's clear that the insurance industry has no intention, does not want to cover this type of situation. Next slide. And it's going to say basically that bodily injury and property damage is excluded for coverage for communicable diseases. I mean, it's going to be a very simple form. It goes on the next slide. When you have nothing better to do, goes on to explain how it's going to, the exclusion applies even if the claim against you is for negligence or wrongdoing in supervising, hiring, employing, training, testing, failure to prevent, failure to report, all the things that are coming out. This is going to be excluded. Next slide. So this form will be on your policies in the future. And there's really, from an insurance standpoint, it would be nice to be able to tell everybody, oh, don't worry, we've got you covered, you know, because then we're the heroes. We're going to cover your business interruption. You're out of work for 6 months, no problem, here's a check. But we can't, it's impossible. And if you go to my last slide, which is my conclusion slide, the industry cannot cover everyone's losses. Physical damage to the premise for business interruption, impossible to pay. Future losses will specifically exclude communicable diseases, but I think we all need to realize that we have to rely on each other, and even our stable government, and the United States is a very rich, stable government, even they can barely handle all the losses, and they're going to paying these losses today based upon our future earnings and our income for tomorrow. And I think we have to realize that nobody is in this alone, and it's all of us, and we all need to cooperate and get through it. And I know many people are frustrated and irritable, and they're sick of this whole thing. But if we can just hang in there a little longer, you know, we'll get through it. So thank you very much.
Wow, thank you, Sue. It's interesting about the riders coming out. I kind of figured something like that was likely going to happen. Are you seeing policies at renewal that have that?
Not yet. It's going to probably start in 2021.
2021. Okay.
Yep.
So if I'm shopping insurance for commercial liability insurance for my condo association, I can likely expect that exclusion showing up with my renewals after January.
Yes, you can. And there's not too many companies. In fact, at this point, there was one company offering communicable disease exclusion back in 2011. They didn't sell one policy. So they threw it away. They said, obviously, nobody's worried about it. We'll just throw it away. We're not going to bother. Of course, today, we'd all be out buying that coverage. But even they are saying, oh, my goodness, we're glad nobody bought it, because when we look at the consequences and how long and how severe it is, they probably wouldn't have been able to. I mean, they would have paid their claims, don't get me wrong, because it was going to be for an infinite amount of business interruption income you had. But yeah, you're not going to find a carrier at this point in time wanting to offer this coverage. Will they do it in the future sometime when they can see how this works out and maybe offer a small amount of coverage? Yes, but right now, nothing.
Yeah, I kind of parallel it to pollution insurance and pollution liability. Just from our side as a contractor. And, you know, our GL doesn't cover certain things, and then we have to buy other insurances that make sure that we cover the gaps. But even those have some exclusions on them. And ultimately, there's nothing that really covers everything. And then the only other question I wrote down through your presentation was, what you mentioned that some instances you see carriers stepping up to cover certain things. Is there anything that, like, is there a specific example, or I don't know? I was just curious more than anything.
Well, it's not from the property side, but from the liability side. There's been a couple of claims submitted, and the carrier's not denying it. They're saying, okay, let's get some more information. They're researching it out. They're investigating what this person is claiming. So at this point, there's not a denial, but I'm not saying that, you know, if the person sues and continues on, then they'll have to defend it. Yes.
Got it.
The liability side.
Okay. Interesting. Yeah. I kind of assumed that everything was going to go down the way that you are saying that it is going down, but I appreciate you taking the time to hang out with us today and present and give us some information.
I did want to interject just a question on our board, because I think it's a good one, and it was basically like you mentioned, you can go ahead and file these claims. It's up in the air whether or not you'll get any money for it. But does making that claim, will that impact your coverage when it comes time for renewal?
No, it will not. In other words, if you have a rental and you can't rent it out because there's no tourist on your short-term rental and you want to file a claim for loss of rents, you can do that. You'll probably get a declination letter because on that one, this business interruption is very clear that it has to be damage to the structure. And without damage to the structure, they're just going to send you that denial letter. It will not affect your renewal. So on the liability side is when somebody says, well, you know, I feel the association or, you know, the business is liable for the fact that I got COVID. Then that's where the liability side will have to take a look at it and investigate it out.
Awesome. Thanks, Kara, for bringing that one up. And thank you, Sue, for taking the time to spend with us today. We appreciate you.
Thank you.
Next up, we have Russell Okoji. He is a PhD and the Principal Technical Advisor for Environmental Risk Analysis. We know Russell mostly from our water damage, mold, air quality side, but as all of us have experienced in the past 6 months, what our businesses do tends to pivot with the needs of the community, and I'm sure that Russell has had to pivot his business a little bit to service a variety of needs around COVID. Russell, thank you so much. Take it away, man.
All right, thanks, Anthony. So real brief, ERA has been in business since 2006. We have 12 employees. Most of them are on Oahu, and we have a couple of employees on the Big Island, so we can service our clients across the state. And this is just a real short list of some of the things that we do, but water intrusion assessments, mold assessments, asbestos and lead. Next slide, please. But what we're here to talk about today is to provide information on the environmental testing and clearances of sites/buildings where a COVID positive individual might have frequented. So what are you to do if you have a COVID positive person in your building? So every day you hear about facilities having an employee who's tested positive for COVID-19. They shut down the facility and then they say, we performed enhanced cleaning procedures. So what is that? And how do they know it's safe to return? Next slide. So we've actually been involved in this issue from the very, very beginning. So we ended up running the first COVID-19 remediation plan in the state for a large hotel chain. Our protocols have been used for other hotel chains, a lot of the large banks, the airlines industry, essential port facilities, as well as the state of Hawaii judicial offices. We've actually, it says 50 COVID-19 hotspots, but probably well over 100 hotspots have used our protocols for remediation. The remediation plan is based on good scientific principles and is compliant with the ever-changing CDC and HDOH guidelines. Every single time CDC comes out with a new guideline, we have to revise our evergreen protocol to accommodate that. So remember, in the beginning, there really wasn't any guidance whatsoever. And the protocols that we've kind of implemented have kind of withstood the test of time because they're scientifically sound. But again, our protocols are evergreen, and as new information comes in, we revise it. Next slide. So apologies. Yeah, next slide. This slide is slightly out of order. So what is the remediation? Actually, I'm missing, did we skip a slide? Okay, can you go to that endless disinfectant one? Yeah, sorry about that. Okay, so the first thing you do when you have a COVID-19 positive case is triage the situation. So we actually have to do sort of our own sleuthing and contact tracing. Where do we need to focus our remedial efforts? You're not gonna just come in and say, we need to do this entire building. You're gonna triage it and determine where you need to spend your resources and efforts. Secondly, you should be using EPA endless disinfectants. So there's this approved list by EPA and the CDC. This one is a little bit complicated. You just think, oh, well, I have this disinfectant, it's on the N list. It's not as simple as that because there are a lot of different chemicals that go under different names. They might have the same active ingredients. A lot of times it's actually very, very difficult to get the specific thing on the N list because everyone is looking for these chemicals across the country. So what we do is basically assist the remedial contractors in kind of vetting those products so that they know they're using an N-list disinfectant. Other people are using electrostatic sprays and ionizing equipment, and that basically attracts, the virus is charged and it gets attracted to these particles and it then precipitates out onto the surfaces so that you can wipe it up. For a long time, the data on this was purely anecdotal. So they didn't know if it worked and how effective it was. Recently, a Japanese university came out with a study and they do say there's a 90% reduction if you were to use these electrostatic sprays and ionization methods. All of the above, the disinfectants, the electrostatic sprays should be combined with some sort of wipe down, some sort of manual method for picking up that viral load. And this is where you kind of get into some of the expertise in dealing with things that you really can't see. So, we highly recommend going with, a seasoned remedial contractor as opposed to maybe a pesticide company that is just kind of pivoting and trying to get into where the market is. The remedial contractors like Premier, they know how to deal with things that you can't see. So you basically have to, for these manual methods of cleaning, you take a wipe and you wipe the surface and you fold your microfiber cloth and then you wipe again. And that prevents cross-contamination, which is a huge deal with COVID-19 and some of the contractors who are just kind of jumping into the situation. Lastly, not on this list is using HEPA or air filtration. So beyond surfaces, you also have some sort of viral load in the air and that needs to be taken care of. So HEPA air filtration, just like your HEPA air mask, the N95 mask, it's a manual method of clearing out the air. So that's something that is always part of our remediation approach. Next slide, please. So what not to do? So I got into a little bit about, using very seasoned professionals for your remediation. There are a lot of companies out there providing warranties. And they're saying, well, if we come in and we spray this whole place down, I'm going to give you a 3-month warranty or a 6-month warranty. And if someone tells you that, I really have to say you need to run away from them. If it was that easy, COVID-19 wouldn't be a problem. And the moment the remediation contractor leaves and somebody comes into the space, they can recontaminate your space. So a lot of these companies are saying that the chemicals have residual effect, and that's true, but the residual effect must be, is only effective if you actually leave some of that chemical in place, which you really don't want to do. Other things you don't want to do is, same slide please, is just inform. When you have a positive case, inform the cleaning staff. And what this says is, and anyone else in the remediation pipeline. That goes all the way down to the person taking out the trash. That person should be informed that, hey, this is maybe some COVID remediation waste. And early on, we had discussions with the landfill and they were actually requiring being informed if it was COVID-19 remediation waste. Not on the slide, we also don't recommend testing for COVID-19 itself when you're doing these testing and clearances after remediation. And the reason why is there are environmental tests, swab tests for surfaces and air tests, but they're extremely limited in their effectiveness and utility. So first of all, they're expensive. they need to go out to a mainland lab that runs a PCR test. There's still false positives and false negatives, and you're waiting for results. So we've come up with a clearance test that would be immediate, and you get your information right away, and you can, either say you need to clean up more or you can reopen. So that's always a question that people have. How come you're not testing for COVID-19 itself? And there are just a lot of uncertainties associated with that. So that's not what we recommend. Lastly, what not to do is have your remediation contractor actually provide their own clearance. So this is very important. So we have a remediation contractor come in, they do their work, and then they tell you it's good to go, that you can reoccupy the space. And in our industry, we consider that a slight conflict of interest, although it's done regularly, but it's akin to grading your own paper. And unfortunately with COVID, because it's something that we really can't see, when we do our posts, we're actually finding almost 100% of the time, some areas need additional cleaning. And you wouldn't get that if your remediation contractor is also providing grading his own paper. Next slide. Real quickly, other considerations for COVID-19 remediations is HVAC systems. So sometimes a specific air conditioning system might have return vents and then feed out that air to other areas. So even if you have your COVID-19 positive person in one area, that the building or the office space could be affected throughout, depending on how these air systems are configured. Bathrooms, absolutely something that needs to be 19 does come out in human waste at very, very high levels. And they're actually using it for to see if you have problems in dorm rooms, that kind of stuff, testing the waste stream. Obviously notifications, hey, we had a positive case, this is what we're doing. Outdoor areas. Now, outdoor areas, yes, the virus does not live as long in these types of situations in UV lighted areas. However, there's perception and there's true risk. If you don't handle the outdoor areas to some degree, then the perception is that those areas might still be contaminated. The other thing that people are doing is kind of waiting it out, saying, well, we're going to shut down for 14 days and we're going to come back and the space is going to be safe. And that's true as well. But again, perception versus real risk. So next slide. How do we determine if a space is actually safe for reoccupancy? How do we, ERA, how do we clear it? So I've already gone into the actual COVID-19 testing, where we actually don't recommend it for a variety of reasons. What we do is we provide a weight of evidence argument that the space is safe for occupancy. So first of all, you used CDC and EPA approved disinfectants, used approved methods, and that's on the remedial contractor side. We come in and we do a visual. And if a surface hasn't been wiped, you're gonna see a little bit of dust. And that means the contractor had missed a spot. So visual is always part of that clearance. We take a UV light and we look for basically biologicals. And if you don't have biologicals, then the chances of having COVID are also unlikely. And lastly, we use a molecular test. So what we do is we take swabs of high touch point surfaces and we look for ATP. ATP is the energy of every living cell. So again, this is not looking for COVID, but it is looking for biologicals. And we compare it to a standard that's used for hospital room settings. And if we get kind of in that range, in addition to everything that was done and that weight of evidence argument, we would say that a space is safe for reoccupancy. And then we provide a clearance report for our clients to have as backup for any kind of questions, lawsuits that might arise in the future. So in a nutshell, that's kind of what we do. It's a lot more that I can get into, but this is the environmental clearance and testing that we perform and has been accepted by just a lot of different organizations.
Thanks, Russell. Kira, I think we have some questions there. Do you want to read those off for Russell to answer?
Sure. So we just have one question. Is ionization approved by the CDC or CMS? CMS.
No, it is approved by like the ADA, which is the Dental Association, but it's not one of the approved remediation methods. In general, it's used for preventative maintenance.
Okay, and then we do have a question for our operations, Anthony. Is there a company that you recommend for this service on Maui, and do we go to other islands?
So yeah, we have a base of operations on Maui. 50 individuals who are trained and ready to roll on Maui. So we can take care of your needs on Maui. And then we also service Big Island, Oahu. And then if you're in Kauai and you got something, give me a call. We don't have bodies there on the ground, but we can definitely get it done. And we have some local contacts that we can refer you to make sure that you're in good hands.
Great. Okay.
Any other questions? I got one for Russell. Can I ask you one, Russell? Is that fair?
Yeah, all right.
All right. So and the only reason I ask it is because we probably get like one phone call a day asking if we do fogging. And so my answer is always, yeah, we do fogging, but we don't just do fogging. So can you, if there's a service provider out there who's only doing fogging, is it going to be effective?
It will precipitate out or attract the viral particles, and it will settle. But it means it settles on surfaces, on your desk, on all these high touch points. Whether or not it's still infectious is another story. It probably is not infectious at that point, or it's lost a lot of its ability to infect. So you must, in our protocols, you must combine it with that wiping. But this goes back to like that whole warranty issue. If you were to just spray things and leave it, yeah, you might be able to have a warranty, but you're talking about chemicals that really haven't been studied. Well, maybe it's on the end list, but have they done the toxicological studies to say that it's safe? And for the most part, the answer would be no.
Okay, and that's my I obviously have an opinion because I've been in this world for 20 years, and you don't stay in this world for 20 years without developing an opinion one way or another. And I tend to be a little more just brass tacks. I like the fact that we go in and we wipe things, because I know once I wipe things, I'm removing the soil load off of them, and then I can disinfect and know that my disinfectant's going to be effective at whatever's remaining.
Absolutely.
Yeah.
Yep.
And then are there certain situations where you recommend testing, or certain situations where you don't recommend testing? Like, are you for every environment, are you recommending testing, or are there only certain environments that you recommend testing?
Well, we recommend testing when you have a confirmed positive case. If you don't have a confirmed positive case and it's just kind of, well, a family member had it and we're waiting on results, a lot of times a business needs to open up. In that case, they might want testing to kind of speed up that process. Outdoor spaces, very rarely do we actually do like the ATP swabs, which would be looking at, something at the molecular level, but we do a visual and we ask that you spray and we ask that you wipe down surfaces.
Awesome.
Okay, so we did have a couple more questions trickle in, sorry. If an employee is tested, should we wait until a confirmed positive to go ahead and initiate that remediation of the space for COVID?
Yeah, so answering that question, not necessarily. You can wait if you have the time to wait. But if you want to reopen quickly, then you need to get somebody in there, do the remediation, and we can clear it like pretty much. If you get the remediation guys in there today, we can clear it tonight. It's immediate. So it's all a matter of, how they want to operate their business.
Okay, and then we did one more about, what advice do you have for those clients that do not want to use disinfectants due to their beliefs or other health issues? Are there any other treatments that you can recommend?
HEPA air filtration. So that's clearing the viral load in the air using mechanical. It's not a chemical. You can use distilled water and wipes. That'll do a lot. What it won't do is kill any viruses that are on the surface. But the act of wiping is actually the greater part of the remediation process. You're actually removing the virus versus treating the virus with a chemical.
Got it.
So physical methods.
Okay, thank you.
Awesome. Thanks, Russell, for making it today. Appreciate you, man.
Okay.
All right, next up, we have a guy who, you know, I've found I call all the time with the deepest, most technical, nerdy questions that you could ever think of. Bill Weber, he's an expert restoration consultant of Richard Avalar and Associates, based in California. He is a licensed general contractor, a board certified microbial remediation supervisor, certified level 1 infrared thermographer, certified restorer from the Restoration Industry Association, certified lead renovator, asbestos contractor supervisor, and he's also the founding member of the Building Sciences Institute. Bill, thanks for being across the ocean, man.
Thank you, Anthony. All right, so thank you so much for having me. We're going to take a walk down the lane of what is it like inspecting these properties that are going through some sort of construction defect or inspections, and what do you need to know about people coming into the HOA, and how do we kind of notify everyone that's what's going to happen. So go ahead, Kira. So taking a moment to reflect, the old days, right, prior to March of 2020, I often like to reflect because life was just so much easier when you go into condominium units and clubhouses and just about anywhere outside your own home. So personal protective equipment, or PPE, the only thing that we really had was shoe covers. It was simple. Let's not get the carpet dirty. Getting into a unit was relatively easy, meaning you can get, you know, the owner will let you in at between 8 and 10 in the morning for your inspection. It was quick and generally friendly and accommodating. So, you know, back before March, it was good. Next slide. And then the early days, man, there was just so much fear. Basically, the inspections that we had were put on a standstill because nobody really knew what was going on. The occupants for sure didn't know what to do. The experts and construction companies, the attorney firms, really all the courts were closed. And what was really difficult was there wasn't any personal protective equipment that was available. You probably know about the shortage there on the islands. You know, no masks, no gloves. It was all being taken up by the medical community, and so it was on a lot of the inspections were just on standstill. But then we got some PPE, and we're ready to go. Next slide. So about now, we see that the occupants actually find more stuff in their unit because why? They're home so much more than they ever have been, and now they have the time to address some of those things that have been there for so long. Maybe in a HOA, you know, that loose railing that's on their balcony, or you know, the signage out front, or you know, everyone's looking a little bit more critical eye. For the investigator like myself, just to give you an idea, I do a lot of construction defect litigation. I also will go in when there's a landlord-tenant dispute or an HOA owner dispute. If there's mold in the unit, we can determine whether it is end user related or if it was building related, things like that. So when we schedule those, now we just need an increased lead time, just because people really want to kind of be in control of what's going on. We have some kind of issues with, how do we get into the home, because they're using that as a home office. So if the husband or the wife are on Zoom calls throughout the day, what does that look like when you have someone like me in the background looking out a window or looking at a ceiling or whatever we're doing? With the children home, that is an issue. One, because of safety of everyone, but also because they're trying to do their homeschool. And so how do you do an inspection of a unit when you have the children being homeschooled? And then conference calls. So, the schedules are to 8:30 or 9:30 to 10:30. They're very specific times because for their work, they have scheduled calls. And so what else? The other thing that's been kind of very, very interesting is that, especially in an HOA, when there's so many people that are home, and we need to do some destructive testing. That means like opening up a wall under a window to see what's going on inside the wall cavity, or doing some removal in a bathroom because there was a fire or flood. Well, within an HOA, especially the high-rise condominium situation, there's banging. And when you had owners who were at work all day, you could do the banging without any problems and create the noise and the machines running. But now with everyone there, there's just seems to be this, not complaining, but just when are they going to get done? And that's the image there on the on the bottom right-hand side. It's just, you have a lot of people coming out of their units going, what is going on? And what are you going to be done? We see the general contractors who have to come out and do the work out there, their fees increase too. I actually have a 29-point list of how fees have, or how COVID has impacted contractor fees, from additional reporting requirements to PPE to training. In California, contractors are required to have a full-time health and safety officer that goes around to every single job site, no matter how big and how small, and monitor the temperature, make sure that they have a hand washing station, that they have sanitizer, that the crews are working no less than 6 feet apart, that they're not sharing tools, that they're not sharing a microwave for lunch. So there's a lot of rules now. And so we're also seeing some less efficiency because of all the social distancing that we need to have. Kira? So now, so when we get on site, especially with the attorneys, we have screening forms. But those filling them out, it's really interesting, because the screening forms will say, do you know anyone that have you been in contact with anyone that has had symptoms? And if you've been in the grocery store lately, I don't see any buttons on people that say, whether they've been impacted or not, or if they've been, if they've known that the person that they were just at has been impacted or not. So, the screening forms that say, are you feeling well or not? I don't know. I don't feel like they're very accurate, but you do the best you can. Interestingly enough, I took this information from one of my colleagues, who said on a particular job, they had no more than one plaintiff consultant, one defense consultant, and the contractor could be in the unit or the containment at one time. And so in a construction defect litigation type scenario, you have a lot of people that may be interested in the outcome of what you find. And so if, for instance, a wall is being opened inside of a unit, and there was a contractor, a general contractor, there was the drywall contractor, the insulating contractor, the stucco contractor for the outside, the window contractor who is in the inside, the window supplier. There's a consultant for each one of those teams and an attorney for each one of those teams, and everybody wants to see that. So how do you do that when you have to be social distance and you can only have a couple people in there at the same time? So, you know, it's complicated. The projects go a lot slower, but you know, the show must go on. So we're dealing with it. We're on the same page. Go, Kara. Thank you. So in the islands, you know, right now, there's not a lot of units that are occupied. And so in that vacancy, the little problems have become really big problems. And I expect that certainly after October 15th, because October 15th, I think travel restrictions really open up for the islands. And what that means is that there's testing that from those like me that are from out of California who are going to job sites in Hawaii. If I get a negative test within 72 hours, I fill out some paperwork and I do my social distancing thing. If I take a test 72 hours prior, but I don't have the test results before I land, then I'm in quarantine until I get the negative test results. Or it's a default to the 14-day quarantine, which is strictly enforced over in the islands. So what does this mean? If you have a large HOA project and you're in the middle of the construction defect claim, it just means that it's going to take a lot longer to make sure that you have all the experts that you need that are off island. And, you know, everything takes time. But, you know, like I said, the show must go on. And I look forward to being in a place that we were before, for sure. What's the next slide? And so what does the future hold? I can tell you that we're now busier more than ever, that there are a lot of claims, and I think mainly because people are home more and they're submitting the claims because they see the problem and they have time to report it. And so there is a large influx of claims. I think that you can expect that there's going to be more claims than you have before, and they might be a little bit more complicated because there was a lot of time that occurred between when the problem with the building started and when you had an expert come in to assess the problem. So I think that for a property manager, I think that if you're able to get more inspections or schedule things to be done sooner, then that would be really beneficial, because when there's damage, it doesn't get better by itself. So I think that's about it.
Awesome. Thank you, Bill. So I did have one question for you.
Okay.
So in my mind, I'm always trying to be mindful of what's changing, right?
Yep.
And so building defect is building defect, but I would have to imagine that because people are in their space more, they're probably noticing more. But has there been anything that people are noticing more as a result, like any category of building defect that they're noticing more as a result of being in their home?
Yeah, so I had a condominium complex of 70 units spread over 32 buildings. And what we had during COVID was the unit owners started noticing stains in their ceilings that they never saw before. And I think that they were just, you know, they're in their unit more, and then they start looking more, and then they chat because they're really not going anywhere except within the complex. So maybe they go for a walk within the complex and they go to someone and said,
Mhm.
I have a stain in my vaulted ceiling. Do you have that? And they said, huh, it's funny that you asked. You know, I noticed that myself too. And so what we ended up having was a HOA-wide roof condensation, because of the unvented attic vaulted ceilings, and the condensation was occurring. And I think part of that was because the homes were occupied so much more, there was more of a load, right? More of a moisture load that was impacting the unit, and that ends up in the ceiling, and then we have condensation happening within the ceiling cavity, staining the ceiling, which created a mold issue.
Right on. Wow. Yeah, I figured there had to be something there because, you know, I just know sitting in my house, I can tell you, well, I've knock on wood, I don't have any building defects because I just completed the renovation, but I can tell you there's a lot more projects that are getting done faster around my house because I'm just sick and tired of looking at things not being done.
Well, you got skills, Anthony. You could do that. There's a lot of people who can't do that, and they're like, how can we get a contractor to fix these things? I'm sick of looking at this.
Fair enough. But I'll tell you on the backside of that, you know, one of the questions that we get a lot is, you know, this is the second shutdown that Honolulu has gone through. And what's interesting is, you know, we have a business that is really difficult to model. Like, I don't know when I'm going to get phone calls for fires. I don't know when I'm going to get phone calls for floods. They just happen, right?
Right.
But what I can tell you is, regarding our scheduled services, we actually, both shutdowns, if it was a scheduled service, if it was our abatement team, our reconstruction team, and we had that project scheduled prior to the shutdown and then the shutdown occurred, 80% of our customers called and said, hey, can we push it off? And so what happens during times right now is everybody's starting to go back to work, and all those people who postpone services for us are now calling us back going, hey, can you get started? And we're like, it's going to be 4-5 weeks on some occasions, just because everybody, you know, we're having 6 weeks worth of work called in 1 week trying to get scheduled to get it done. And I have to imagine the building defect side is probably experiencing the same pains as we are on that.
You know, it was really interesting that you say that, because with the courts all shut down and that made the attorneys, you know, what are the attorneys going to do? Because you have to process a claim and you have certain dates by which to hit certain benchmarks in a claim, especially in the building defect industry. You have a certain amount of days to report it, and the contractor has a certain amount of days to get on site to, you know, to agree or disagree or make an argument, and then a certain amount of days to fix it, you know, so on and so forth. And you know, those days kind of come and go, and then the attorneys are saying, what do we do? And it was pretty crazy. But I can tell you that as soon as the first tier we got out of the first tier and construction started again, oh my gosh, it was a floodgate. My phone was ringing all day, every day, because we, you know, usually when I get construction defect claims, I get, let's say, 1 a week. Right. So that's a launch of a new claim where I'm meeting with the attorney, we go for a job site visit, things like that. Well, then we didn't have any. And even my old claims that were working just kind of stalled out because you couldn't leave and go anywhere. Yep. And then all of a sudden it opened, and it was like these double doors just opened, and every attorney calling saying, when are we going to have the destructive testing scheduled? We have site visits. You know, you have a deposition coming up, you have an expert meeting coming up, and I just, so it was interesting.
I get it. Well, thank you for carving out part of your afternoon to help all of us and engage in this conversation. Kira, do we have any questions for Bill? I think I just saw one pop up.
Let's see, yeah, so. Oh, no, there wasn't a question. I'm sorry, it wasn't, no. So we're good.
No worries. All right. Well, awesome. I want to thank everybody for showing up today. Sue, thank you so much for spending some time with us today. And like from me to you, thank you so much for all the hard work that you do for condo associations around the state. Sue's always involved somehow. It's like the 6 degrees of separation from Sue Savio if you're a condo association. Russell, appreciate you and your technical expertise and always serving as a resource for us through the years if we have questions on testing. And then Bill, building defect stuff. Appreciate you always being willing to take the phone call and talk about something weird with me. I've appreciated that over the years. And then everybody else who made time today to attend our webinar, I'd like to thank you. Just as a reminder, we will be pulling giveaways for those winners who attended today. So cross your fingers, expect that somebody from our company will be in touch with something nice and something local. Thank you, everybody. We appreciate you. Stay safe. Aloha.
Thank you.
Aloha, everybody.
Thank you, Anthony. Thank you.